welcome back to the Fill Me In podcast, where we dive deeper into the world of aesthetics. Today, unfortunately, John is sick, so we have some special guests with us. I have our co-founder of Exhibit, Melissa, and Brittany, our esthetician. You can find them on Instagram at melissa.the.pa, and Britt, I think it's just Britt Esthetician.
Britt_esthetician.
Perfect. So thanks for joining today, guys.
Of course. Thanks for having us.
Yeah. We did a couple episodes on PDGF and treatment stacking and all that good stuff. And I feel like on TikTok and Instagram right now, what's really trending is pre-treatment and the importance of home care and things of that nature. And I feel like people don't realize the difference you can make in your skin by just, one, doing skincare, and two, doing skin treatments. So I really wanted to talk about the importance of pre and post treatment, as well as some of those skincare procedures we can do. I think a lot of hype right now is around regenerative injections, you know, even like Skin Vive or PDGF and all these other ones. And we've had things around for years like microneedling and lasers that produce your collagen too, and aren't something that are so much of an outside source. So I wanted to kind of chat about those things and the differences they can make. So
yeah, I feel like Britt's going to have a lot to say about this.
Oh, yeah.
Just let her go. No,
yeah, right?
No, but I do always say, like, I love microneedling because it's been around for so long and there's just like a lot more research behind it. So I feel like everyone's always trying to reinvent the wheel and hop on the new. Like, you know, when it comes to anti-aging, everyone's always excited to try all the new stuff. But, like, maybe let's just wait until there's more research.
Yes, yeah, right?
Yeah, we like to watch and wait.
Yes, yeah.
Yeah.
No, and I think, too, like, definitely increasing your growth factors and all that is amazing. But we can do that as well with procedures that we already have. And, again, have really good backed research and evidence base and all of that. So definitely, though, pre-treatment, I think that gets lost in a lot of practices, and patients don't realize the importance of pre-treating for even microneedling, laser especially, but even something like microneedling, and why it's important. Pre-treating, for those listening, patients listening, would be like starting a skincare regimen before the procedure. So you want to strengthen the skin, you want to strengthen your skin quality, and you want to give your skin the ability to heal better than it would have if you didn't do that. So I feel like Britt's going to be a good one to chat about this, but, you know, types of products that we want to add into a regimen, or even building a regimen from nothing. A lot of patients have not even done anything besides wash their face, you know, or put a moisturizer on. So products that you think are really beneficial pre-treatment wise.
Oh, you're asking me?
What would you say? Like I know retinol is a big one, but I think people are really afraid of retinol.
I know. Thankfully, Alpha Ret has helped that a little bit, being as, you know, it doesn't have
tolerable.
Any. Yeah, it's very tolerable. It doesn't have any of those anticipated reactions. So that's been really helpful because, retinol is going to help you build collagen and kind of strengthen the skin. I will say it's funny because you said it kind of gets lost, and I'm guilty of that too, but I'll be honest, most of the people I microneedle are clients, so I know what they're using and everything, but every so often I'll have a consult and I do feel like what the person's already using and like their skin quality, I could see it. It's, you know, and I know that they'll be able to handle the microneedling and everything, that they're already at a pretty good baseline. But yeah, it definitely does get lost, the pre-treatment for sure.
And it heightens the result. And I think that's something that as a patient, if you're investing all that money to go home and just use water and CeraVe, you know, like,
oh Lord,
the amount of people that say that to me too, like even straight after they microneedle, I've had people, oh yeah, I'm just going to use water this week. I'm like, no, you have to wash your face.
Yes. And that's another thing too, is people don't really realize how dirty our tap water is.
Yes.
Like you really shouldn't be washing your face for almost 24 hours.
Yeah.
Because there's so much potential bacteria that could get in there, and we're creating these little microchannels that could cause infection, and you have to use specific stuff. And that's why when Britt tells you about these things, she's not just trying to sell it to you. Right. She's actually, you know, trying to help you. But retinol, I think, is a big one that scares people away. And I am one of those people because of the fact that I've never been able to tolerate it. So I'm super excited when I'm no longer pregnant to try Alpha Ret, because Alpha Ret is from Skin Better. It is a retinol, but the delivery system is a lot different. So you don't get the anticipated reactions of the redness, flakiness, dryness, all that terrible stuff no one wants to go through.
Yeah.
I love it because it has the alpha hydroxy, it has the glycolic. So you're getting even more exfoliation, but I use it every night. I literally don't get any reactions at all. So I love it.
Yes. You're still getting all the benefit without all of the, what they call them, the retinol scaries.
Yeah.
Remember you, Nicole, with like the red mask you had essentially.
And I tried to do my neck and it was like, I'll try to find pictures of that. We could put it in because it was, but I'm too sensitive. And some people, I did everything the way you should do. And I started every third night, then every second night, I worked my way up to every night, but I would be dancing in my bathroom. Like I'd put it on. I'd be like, I'm on fire.
I think that's the other thing too, is like people aren't giving these products enough time to work.
So true.
And you did that. You gave it, I think it was like 8 weeks.
Yeah, I think it was almost 10 weeks. Yeah. And then I couldn't do it anymore. Yep.
Yeah. So when people are like, oh, it doesn't work, I had all these reactions. I mean, maybe, but how do we know that that's, doing anything if we're not giving it enough time? And then you're going to get these, procedures done. You're doing your microneedling, you're lasering, and you're wondering why you're not seeing results either.
Yep.
So.
I remind people all the time, all those before and afters you see on the skincare websites, those are typically 12 weeks.
Right.
Like, and I've had people even DM me like, after the week they buy something, when do I expect to see a difference?
Not this week.
Like not today.
Like,
what?
That's why it's so tough to get a good before and after for skin. So I'm so happy that we have so many good ones because it really is tough to have people commit to that.
Right. Absolutely.
So when they do, I mean, it really does show.
Yep.
For sure. Cause like, I feel like I've been sharing a lot of before and afters lately. And the big difference with the ones I've been sharing, they're all people that have a regimen. They're all people that have done multiple modalities or have been treatment stacking, however you want to call it. And that's really how you're going to get the best results. You can't just choose one thing and just roll with it.
No, that's so
everybody
true.
Regimen, microneedling, peels too. That's been my new thing, having people do peels after their microneedling. And they've had such nice results because it's really like tackled the pigment in ways that the microneedling doesn't. So,
Hey guys, just popping in to remind you to like, subscribe, and hit the bell for notifications. Also, don't forget to follow us on Instagram, Injector John and Aesthetic Nurse Nicole. Thank you so much for watching. And if you have any questions, leave it in the comment section.
Yep. Treatment stacking. We love it. And that's why too, I wanted to talk about this topic because I had like, I don't know, maybe 5 patients last week tell me, I hate these little lines like around my mouth, or like when I smile, I get these, which again is normal. We all have expression and we should see lines, and we're not a filter and we're not a still picture. But when I tell them I can't do filler there, they're like, well, what do you mean? Like, yeah, I could do a little Botox down there, but it's not going to drastically change anything, And I bring up the topic of home care regimens, making sure you're doing your skincare and laser and microneedling. And to some people, it's such a foreign topic, but it's like, you have to work on the skin quality. It's happening because you're losing collagen and elastin, and you're getting a little bit of laxity in the skin, which we all do, unfortunately. And if you love the sun, yours is going to be 10 times worse. So it's just, you have to work on things that are going to actually help the quality of your skin. And then our fillers and our Botox and our lasers and our microneedling and our peels, everything is going to look that much better and that much more noticeable too.
Unfortunately, people want, quicker fixes.
Right.
But, when you put the time in, it's always worth it. Yeah. And I tell everyone, I'm like, look, Botox treats muscle, it doesn't treat skin. So your overlying skin can improve, but if it's too lax and then we relax the muscle under it, it's just going to get more lax.
Right.
So you have to treat the skin in a different way.
Yep. And I think with all the regenerative talk, like we talked about in the beginning, we're seeing that now. And I think patients don't realize we've had so many different modalities already on the market that are able to do this. And these new injectables and stuff are just heightening that result too. So again, it's still treatment stacking. You still have to do them together. It's not just a one answer.
Yeah.
With lasers, I think a major thing is making sure that you're inhibiting that pigment prior to treating, which I think even gets lost on some providers sometimes too. Even when I heard it, I was like, oh, that makes so much sense. If you're inhibiting pigment for 8 to 6 weeks before you come in for the laser, you're going to have much less chance of even an adverse event. If God forbid the laser's a little too hot, or you have a spot that just reacts a little bit more than any others, like it's going to help keep you safer too. So I think a major again, retinol is a good one for that. But you might a lot of the time see hydroquinone, which is also another one that's very irritating and causes flaking and redness. And so alpha ret is still a good option there where you don't have to do that. And then Zeo has Bright Alive.
Yeah.
Do they have any other ones? I think Bright Alive is
Bright Alive is essentially like Zeo's Even Tone, I feel like. And then we have Even and Correct from Schematica. So quite a few different pigment inhibitor options.
And I would say Even Tone, Even and Correct, and Bright Alive are all non-reactive ones, right?
Yeah.
Yeah. So like, you know, hydroquinone, you're taking on a journey.
Yeah.
A lot of people don't really like care for it too much just because, again,
very similar to that retinol.
Yeah.
And you can rebound with hydroquinone, which is why it scares me a little bit. I remember actually last year, funny enough, because I'm going to IECSC today. Last year I took a pigment class. This year I'm taking an acne one, side note. But the pigment class, they were very anti-hydroquinone. And it definitely kind of put the scare in me a little bit too. I'm not going to lie. But that's the big thing, is that people rebound from it, which I never really knew.
Right.
And you can only be on it for a certain amount of time, really. It's not whereas these
like
other pigment
months.
Inhibitors, they're gentler and you can use it forever.
Right.
So
yeah, it's interesting. Yeah. And it's, I guess, because it's so harsh too. And you can get a lot of lightening with hydroquinone, which sometimes is not the best thing either.
Yeah.
You don't want to over lighten. So so there's so many things on the market that you could be using that you don't have to go through all these troublesome, how do you hide flakiness? You can't. And the burning. Oh my God. I don't ever want to experience that again.
Do you remember my eye?
Oh my gosh. Yes.
The eye.
I wonder if I could find a picture.
Tell everyone the saga of the eye.
Oh Lord. I don't know. I did a peel, which that wasn't the issue, but then I started using like a harder retinol and my whole eye would just like flake up. It would get swollen, really itchy. And then I stopped using it. It would slowly go away. And I was like, all right, I took like 3 months off from using retinol, which for me,
we don't do that. Retinol is Mel's baby.
Literally. So it got better. I started using it again and it happened again. So I said, you know what? It's this retinol, which I used to use in my 20s all the time. I used to use it every night.
That first retinol was like 4% or something crazy, right? After the peel. But then the one you normally use, I think, was like 1%.
Like the 0.5%, like the usual. Yeah. So now I use the alpha ret and I love it. I use the peel pads. I love it.
And no eye reaction, right?
No eye reaction. But it's just crazy. Like your skin changes over time too. So I think that's important, just to, again, give things enough time to, really see if you can tolerate it.
Yeah. And I think people forget that too. Retinol travels underneath the skin.
Yes.
I was just going to say, it's so funny because I just had a client who did the Zeo 3-step peel and she was like, my chest was flaking. And I've had other people tell me that their ears do. And I said, yeah, well, it does travel under the skin. So that's why even with your retinol, like people are like, should I put it by my eyes? Da, da, da. I'm like, you can stop here because it's going to get there.
Yeah.
Like,
it will travel. I remember when I did the 3-step, my ears, everything peeled like
it's
up through my earlobe. My eyebrows peeled, even though you don't go over the brows. Yeah.
It
just
crazy.
Travels through. And that's why I think too, they say you can put like a skin barrier if you want, like a Vaseline or something. If you're someone that, like Mel, has the eye reaction, you could do like your normal skincare, put your eye cream, put Vaseline, and then you do the retinol. But something like Alpha Ret allows you to not have to do that.
Yes. So now I don't have to deal with it.
Yes, exactly. But no, I can't wait. I have a whole plan. When I'm no longer pregnant, we're going to redo my Vizia. Vizia is a skin analysis that we have here at Exhibit. I think John actually has it at his location too. It takes very like up close and pixelated pictures of your face. Like you can zoom in, you can see the pigment, you can see the lines, tells you your true skin age. Like I'm just curious to see how much has changed. And then I want to start, right? I'm going to start skincare only, then the laser, then injectables. And we'll kind of like track it. Because I've gone this long without Botox. I'll live.
But it goes to show what good skincare can do.
Right. So I want to see like all the changes we can get just by doing each little thing. And I'm excited to start skin better because I've just never been able to tolerate a retinol. So I'm excited to see.
Yep.
And my skin has changed so much through this pregnancy.
But you have like no pigment issues.
Yeah,
I feel like you really like.
Well, look at the color of me. I mean, I don't touch the sun.
Even after your vacation, you're still.
Yeah, I'm this white. I had freckles as a kid. I had like hundreds of freckles on my face, but because I had such bad acne, I did benzoyl peroxide, and I swear that it bleached me.
Yeah.
I swear to God.
Looks great. So
thanks. Yeah, right. I'm like, I started really young, apparently.
Yeah. Oh my God.
Going back to like pre and post care, I feel like a lot of people, they, like Mel said before, they want the quick fix, but you need to understand that it's always about commitment and consistency. And what you do at home is going to be way more important, really, as much as we hate to say it, because we want you here for these treatments, but that's really 80% of your results right there. That's why I always tell people to like, yeah, if it's not broken, don't fix it. But we're also, this is really the thing that drives me nuts, that I'm just going to say, is that clients will come in and they'll complain about their skin. And then they'll tell me what they use and they'll tell me how much they love it. But then I'm like, you're telling me you love your skincare, but you're telling me you don't love your skin. And I always just try to say that because I feel like I don't want to argue with anybody. I'm not the type of person that's pushy. I do say if it's not broke, don't fix it a lot when they're like, you know, when I could tell they're really not having it. But I'm also like, at the same token, especially when you're investing in things like microneedling, laser, they're not cheap treatments. We're all aware of that. And it's not that we want you to spend more money. It's that we want you to protect your investment and we want your results to last longer. You know? So it's only going to, one, keep your skin quality where, you know, at a better place, keep you at a better baseline, keep your skin maintaining. And so yeah, like we're not out to get you. We want your skin to look the best. It's a reflection of us too. So
amen.
Don't you feel like people get like excited?
Yes.
I get so excited about starting new skincare
regimens.
Products.
Yeah, absolutely.
Some people do. Right? Those are my favorite people. I hate to say.
Like I remember someone, there was like 2 people came in together and I swear they bought like 6 new products each. And it was like, they just were like, I whatever you say, I just want a new regimen. They were so excited about it. I was like, yes.
No, and especially I feel like if they're not used to using something, it is exciting because and if I do like to find that middleman, like 4 to 6 products with a cleanser and a moisturizer. So it's not too many steps because it can be a lot too.
No, for sure. And I always ask people too, like how many steps do you really want to use? Even a woman yesterday I had, she's an example of somebody that I met her a few weeks ago for a consult. Actually, Corinne recommended her. So thanks, Corinne.
Love you, Corinne.
We love you.
And the woman already used all Skin Better products. It's funny because I talked to her about like, you know, why don't we just start with a facial, see how your skin is and go from there. But I did tell her about microneedling based on like what she was looking to achieve. We did a Visio with her, this, that, and the third. And it's funny because she was so eager for more product. And I was telling her like, you have like a perfect regimen. What am I going to sell you? I said, you want to restock on stuff while you're here?
Right.
So it's funny. Yesterday she came in for microneedling and I thought we were going to go with the facial first. And she even said, I'm sure you didn't expect to see me for this so soon. I'm like, yeah, I thought we were going to do. She's like, you know, I just have to do the microneedling. And it's funny because, you know, we have a package where you can get skincare at a discount coupled in with your 3 sessions. And she's like, I think I'm just going to do that. And, you know, she was asking me about all this other stuff. And I said, do you really want to add more steps to your regimen? Because like, honestly, I love everything you use and I think you're doing the right thing. Like her skin was in good shape, you know?
Yeah.
Even she was so terrified to do the Visia and her skin age was younger, which
Woo,
she was shocked to
yes.
see. And I was like, see, like everyone always thinks it's worse than it is.
Right.
But it's funny because she kept asking me about the growth factor serum and this one and that. And I was just like, again, if you want to add another step, that's on you. But I think what you're doing is right.
It's
Like
already good, yep.
sometimes like they actually are doing the right thing. And I'm not just going to push you to
Right.
be obsessed with something else or whatever.
Right.
And we just picked 4 products that she already used. So,
Right. And sometimes I think like growth factor is great because it's helping support your tissue. But at the end of the day, you want, especially if fine lines and texture are your concern, you want something that's going to be renewing that cell turnover.
yeah.
Where growth factor is just going to be more of like moisturizing and like supporting your cells, but it's not going to be making fresh skin.
Like, yeah, they say, you know, that it does aid in our collagen and elastin production. And I'm not saying that, I mean, I love growth factor serums, but I just feel like if you don't really need that help there and your skin's looking like it's in pretty good shape, why add something else?
Right.
I don't know.
A 5th layer.
Yeah, exactly.
Yeah.
I'm like, you know, there's just going to be another step for you.
Right.
Like,
is it really going to make that big of a difference?
if it's going to make or break you when your skin's in good shape and you're microneedling and you're using good products. So, you know, as much as it is exciting when people want to try something new, sometimes you just got to be honest and be like, you know,
what you're doing
the
is
right
working,
thing.
right? Exactly.
Yeah.
And then adding in those treatments. So the microneedling and things that are going to, and for those listening, microneedling is really great at boosting your collagen. If you do 3 sessions or 4 sessions, I believe it's 300 or 400% increase in your collagen production, which is crazy. So that's really great for like the little lines around the mouth, like any fine lines anywhere, and then just kind of strengthening the quality of the skin. So it will look more luminous. I don't like to say tighter because it's not like you're going to get tighter, but it definitely does make you feel like your skin is tighter for sure.
Yeah, because it's aiding in the collagen and elastin production. So like that's really the proteins responsible for like the structure of your skin. So it does, like people always do this, like they're looking for a facelift from it. And I'm like, it's not going to do that, but you're definitely going to be a little firmed up. But like,
and I feel like when you look more luminous, everything looks more lifted. Like it really does make you look tighter because the quality of your skin is better.
Yeah.
Where laser is going to boost your collagen too, but it's going to, I think, affect pigment definitely a lot more. But it definitely helps with that, the lines and the texture too, for sure.
Yeah. And then when you go in with your filler, Botox, it's going to look even better. And you probably won't even need as much.
Yep, exactly.
So,
Britt, what are your thoughts on like monthly treatments? So if someone comes in and they want to do the 3 lasers or the 3 microneedling, you can also, which we love, and Olivia has brought this up on a previous episode, microneedling is really much more summer safe. So doing that in your warmer months and then laser in your winter months and just on that cycle yearly to boost your skin and keep you as young as possible. So we really love to see that. And we all honestly do that. But what is your thought on having them come in monthly for like diamond glows or dermaplaning, things like that?
Yeah, because back to what I was saying before, a lot of the before and afters I've been sharing, they're all people that have memberships here. So yeah, you want to take into account like the improvements we've seen from the microneedling sessions, but it's also the fact that every month they're taking care of their skin and they're also using a good regimen at home. So it's not as simple as this is your microneedling before and after. Like most of the people here really do put in the work and they come in monthly for their diamond glows. It's really good to just like, again, it's aiding your skin quality in a different way that the microneedling and the laser aren't. Like they're not giving you a deep clean. They're not exfoliating you. I mean, maybe the laser to an extent with like a little resurfacing, but these are more like surface level improvements that like you need to. Like you can't just do one or the other.
Right. It all goes together. Same thing with your Botox and your filler. It's all treatment stacking.
Yeah. And like I said, that's why I've been calling like lighter peels after microneedling, like the icing on the cake, because a lot of people do bring up pigment when they come in for microneedling. And I have had people have improvements in pigment, but I always remind them this isn't a pigment treatment. It's a collagen building treatment. Yes, sometimes people's pigment is kind of corrected as a result of the act of microneedling because it is promoting the cell communication and getting things to kind of regulate themselves. But I feel like I always kind of tell them, like, those people kind of almost just got lucky with their pigment being improved. It's not really
meant
necessarily.
for that, right?
Yeah.
Yeah.
So that's why I'm like, if you still have some stubborn pigment lingering, why don't we do a few peels at the end?
Mm-hmm.
And it's really been helpful. I've read a lot about a lot of estheticians like to do the peels first.
Interesting. And
which,
then,
you can do that too. But I don't know. I feel like the microneedling just puts, like, it improves your skin so much more from the inside out and more at a cellular level that I feel like it puts you at a better baseline first.
Right. I would agree. I would feel like it would kind of almost bring that pigment closer to that surface. And then
I feel it does.
Yeah.
Makes more sense.
Yeah. And if you have someone that has very stubborn pigment, then the BBL laser is definitely going to be your best bet. And then after the fact, doing something like microneedling or things like that for really, and we can share some pictures here too. Like BBL laser alone does a lot for texture of the skin and fine lines too, because it does boost the collagen as well. But I just think there's nothing better than if you're able to do both. Like if you can do that microneedling in the summertime and the laser in the winter, like you are going to be like, holy crap, my skin looks amazing.
I'm obsessed with the BBL. That you just did it.
Yeah.
I noticed it already. One session.
People love it.
Yeah.
Like the redness in my cheeks and everything. I was like, God, I was like, my skin looks so good.
Yeah. And that's the whole thing.
You had no downtime either.
Right. Yep.
Yeah.
Yeah. Britt was texting us. We were all asleep. I used to be someone that was up all night and I slept late in the morning. Pregnancy has changed that too. So I am on Melissa's bedtime schedule now. So,
oh my God, literally, you guys.
What's my excuse?
You have children. Kids, that's what it is.
True. I'm defeated by the end of the day.
So me and Melissa are literally asleep by like 9 p.m. But Britt texted the other day. She's like, I got my BBL laser today. Can I shower?
No, because I was Googling like the hot shower and it was saying like some stuff was saying that. And I'm like, is this really going to do something to me? Like,
I feel like, what was it, like 8 hours later?
Yeah.
It was,
It's like you don't want to do the BBL laser and then put a hot towel on them and then send them into the sun because the skin's going to keep heating. You want to cool the skin down after that. But yeah, the BBL laser is really amazing, not only for pigment, but like you said, the redness, rosacea, little capillaries, all that good stuff. So yeah, I'm like, I seriously, I'm over here getting excited because I can't wait to do mine.
I feel like you're building your regimen in your head right now.
Oh yeah,
You're like,
for my pre-treatment, Britt, what would you put me on?
I would say, especially if you want to switch to skin better. Sorry guys, it's my favorite. I'm
a Zio girl. Everyone knows I'm a Zio girly. So
yeah. Oh, that's true. You are a Zio girl, so you can do. We'll see where you're at.
Yeah.
But I just feel like I want you to use Maestro so bad.
Okay.
So good.
Tell everyone what Maestro is.
Maestro is like a skin balancer. So like a lot of people will describe it almost as AI for your face. Like, because it knows what your skin needs and it helps kind of balance that out. Since it does this, it helps so many different skin concerns. So it's good for texture, redness, pigment.
I love it for my pores.
Your pores.
Yeah, pores.
Yeah.
It's
I
one
noticed
of the
a
few
huge
things.
improvement.
In your pores,
for sure.
Yeah.
So it helps so many things. That's the one product that I recommend all the time.
Mm-hmm.
Yes, because I love it, but also because every time I've recommended it to someone, they've come back and they're raving about it.
Yeah.
It's that one product that everyone loves.
Yeah.
So I do tend to fall back on it because I'm like, all right, like I know they're going to be happy when they use it.
It's a consistent product, which is important.
Very consistent. Like, and obviously everybody's skin is different. Everybody's different. Sometimes there is trial and error, but generally I do fall back on certain things a lot because when they consistently get good reviews from people, I'm like, all right, well, this is good.
Yeah. And it's not like you're just seeing it on the website. Like you're getting to see it firsthand. Yeah.
So that, and I love that with even tone together.
Okay.
And even me, like, because sometimes people are like, well, do I really need the pigment inhibitor? I mean, but at the same time, they work really well together. And I feel like those two are really like kind of like your glass skin serum, you know?
Yeah. And at the end of the day, if you're going to be doing laser or something, then you do need the pigment inhibitor. Yep.
Yeah, for sure. So if you're going to do the laser, I would say those two are really good.
Okay.
You know, definitely Alpharet, but obviously stop using it for like a week or so before your treatment.
Mm-hmm.
Honestly, you'd probably be fine, but just to go by the books there. Yeah, one of the things that Skin Better actually recommends is Even Tone Maestro and Trio Luxe.
Interesting.
For laser pre and post care.
Mm-hmm.
Just get kind of like that extra hydration from the Trio Luxe. It's a little heavy for my skin, but a lot of people do love it.
I could understand maybe like post-procedure, but
yeah,
but
it's interesting about pre,
I guess they're thinking to like really condition it.
Mm-hmm.
Right.
Yeah, interesting.
But that is a really good, I actually just had someone DM me the other day, like, oh my God, that Trio Luxe, like I had these red patches that I've had for months and now they're gone.
Wow.
Yeah.
So it's very hydrating.
Yeah. It does the trick, that's for sure.
So yeah, those would be my big serums to recommend for sure.
And I have been using the cleansing gel from Skin Better, which I've been loving because I've needed, well, it's just so funny because I've just needed moisturizing and gentle. Like this is not my usual.
Yeah.
I'm like, where are my actives? So I can't wait to get back on that. All right. So Maestro, Even Tone, and Alpharet. All right. Mel, what's your current regimen?
Oh God, how much time you have? No, I'm kidding. All right. So it depends on the cleanser. I'm probably like 85% Skin Better, 85, 90%. I either use the refining foam cleanser. Then I actually use Even and Correct pads from Skin Medica because I love those in the morning. And then I'm using the Maestro, the Even Tone. I am using the Alto Advanced for my vitamin C. It's the only one I've been able to tolerate without breaking out.
Interesting.
Or I'll use like Daily Power Defense from Zeo, depending on just what I have. I like the Even Tone too, by the way. I don't really have pigment, but like, why am I going to wait to see if I have pigment issues? I'm going to inhibit that pigment. I love it. Maestro, I use either just like the regular Trio moisturizer. The hydration boosting cream is really good. The tried and true exfoliation polish from Zeo. Never gonna stop using that.
Oh, duh, yeah.
That will never go anywhere. Yeah.
I don't care what happens.
I do still use that like twice a week because you do. Like you get to a point when you wash your face, you can just tell that you need an exfoliation.
Yeah. Like it's chemical exfoliation is one thing. I love the Alpharet for that. And I use the peel pads too a few times a week just to get deeper. I like the clearing serum from Skin Better if I'm feeling like I'm breaking out a little bit. But no, sometimes you just need like a good scrub.
Right. Yep.
Yeah.
And for those listening, it's like a safe apricot scrub for us 90s kids.
It's not St. Ives.
But you get that same feeling after, like you're like, oh, I'm just so soft.
I love it. I actually brought it with me to Aruba because I was like, sometimes just after being in like that hot weather. Yeah.
I'm all dry now. Like even it's just coming from the different environments and like a little bit of sun exposure. I'm like, I have like little dry patches everywhere.
Yeah, no, I love it all. And IMAX.
Oh, yes. Oh, from Skin Better. Everyone always asks about eye creams. Yep. From Skin Better. Okay. I've been loving the, what is it? Instant Bray?
Yeah.
From
Skin Medica. You've been into that lately.
I really love it. Nice.
Or Mel, what about the other eye cream we've been using?
Oh, teaser.
Are we allowed to talk about it?
Yeah.
I just put it in order.
Oh, we did order. All right. Yeah. So then we can talk about it.
And Mel has before and after pictures.
Yeah. I mean, I did take the before and after. So my under eye's always been my, like, probably my worst besides my chin. One of my most concerning areas for me. So, and I think a lot of people come in asking about like, what can I do for my under eyes, the lines and everything like that. You have to have some lines under your eyes. You have to. But obviously you want to work to prevent them from getting worse. And you just want to strengthen the skin. There's a very thin skin. So I use the Alpharet IMAX, right? Is that? I never know the
actual name of it. Yeah.
At nighttime to work to actually treat it. But I've been loving the HA eye serum, right, from Ourself for the daytime. I mean, it's just so hydrating, and I feel like it blurred my lines.
Yeah, like you looked
instantly.
like plumped almost.
Yeah, it was very hydrating.
Yeah.
Really liked it.
And it's lid safe, so I like anything that can go on the lid too.
Mm-hmm.
Yeah, I put it all over like my orbital bone, my lid, everything.
Yep. And we know Mel has eye problems, so.
Yeah, exactly.
I know. So it's been completely fine. Yep. Yeah, no, I love it.
Yeah, so that's something exciting coming to exhibit.
Mm-hmm.
A new line.
Yeah, and the HA serum, right? Did we order them?
Mm-hmm.
Okay. All right. Just making sure.
Give us the lineup.
So we got their cleanser, the replenishing serum, which is an HA, but it has so much more in it.
Mhm.
So I think they said they're actually changing the name soon because they don't want people just, associate it as just an HA.
Right.
But the HA also, with that same technology, they have an eye serum, which is really nice, and a moisturizer. So that could be a nice, easy regimen especially for injectable patients.
Protect what you inject.
Yeah. We'll talk more about it when we get it, but it has really cool and impressive technology. And I am excited about it. I think people will like it and like the simplicity of it.
Mm-hmm.
And they have a lip product that helps enhance your lips, whether you want to help boost the filler you have, or if you're a lip flip person, or maybe you're not sure if you want lip filler, because it works pretty well. Mel popped it on and sent us a picture, and her
they
lips
look freshly injected.
And
it's great too, because I think it is pregnancy safe, right?
Yeah.
Yeah.
So if you feel like I want my lips done, but obviously we can't inject when you're pregnant, then you can use this and it works.
Right.
Let me tell you.
Ooh, I'm so excited.
Yeah.
Yeah. So a nice, easy, quick regimen for those people that aren't like into too much.
Mm-hmm.
Yeah. Good.
Yeah. The cleanser was really nice too.
I love a good cleanser.
I try everything.
No, because we know.
Literally everything.
No, because it's like, I hate when you use a cleanser and you almost feel like the soap scum on your face after.
No, this was so
God.
clean. Yeah. This rinsed
I just
so
want to
clean.
feel clean after.
Yes. Yeah.
All right, guys. Well, this was great. I feel like we hit all the topics, like definitely treatment stacking. I know we talk about it on like every episode, but it's just so important. Doing your microneedling, doing your lasers, doing your Botox, doing your filler, doing your skincare, doing your Skin Vive and PDGF, like all these things go together. But it's definitely, you want to find the right place to help build you a plan. And like we said, microneedling in the summer, lasers in the winter, your skincare 24/7, morning and night, every day. And then your monthlies, a good peel or a good facial, but everything goes together. And if you guys ever want help building any kind of regimen or anything like that, Britt is always available for any kind of appointment. She's a very busy lady, but
always make time.
We'll always make time. So definitely you can, we all have the links in our bios to book, but you can always give us a call too. DMs are hard. They're hard to catch every DM. So we always say, make an appointment, much easier.
Yep.
But Britt, tell us your Instagram one more time.
Britt_esthetician.
Perfect. Thank you. And Mel?
It's melissa.the.pa.
Perfect. And thank you guys so much for taking the time to sit down with me. We're wishing John feels better for next week.
I know. Feel better, John.
Yeah, feel better, John.
That guy doesn't stop. He's run down.
He does too much. She does too much.
Yeah, so do you.
Yeah.
Oh my God. You guys are like,
guys.
Yeah.
We're all in the same boat.
I say we all go on vacation together next time.
I agree.
Yeah.
We need a retreat.
Yes.
Yeah.
I
know it's so funny. I just need to add too, like everyone's like, well, now that we're kind of out of that, but especially like January, February, so many people are like, oh, you guys slowing down a little here? Like, no. And I was like, I know it's a blessing and a good problem to have, but no, we have not slowed down at all. We're probably busier.
Insane. Yeah. And it's so funny, right? And the second sun comes out, people are all of a sudden want to do everything too. So it's like you just see so many more patients trying to get in. But all right, guys. Well, thank you.
Thank you.
Thanks, guys.
Thanks for everyone for tuning in. We'll see you next week on Fill Me In Pod.
All I want